Today we are going to be talking on the Dr. Dean Show, an important topic that we get to talk to a lot of parents about, and that is ADHD, Attention Deficit Hyperactivity Disorder. We are joined by a special guest today, and I will be introducing her, and she is absolutely fabulous.
Dr. Dean Beckloff has been working as a counselor with students, families, kids, and teens for over 40 years. As the founder of the Beckloff Behavioral Health Center, Dr. Dean focuses on children and families that need a little extra help via counseling. Each week with Dr. Elizabeth Zach, we discuss all things family related to help people create the positive family they want to build. Welcome to the Dr. Dean Show.
Today we're joined by Megan Rosewell. She is one of our therapists at our office at the Beckloff Behavioral Health Center. And Megan is also our Director of Children's Services, so she has a strong interest in working with kids and families. She also does some excellent work with adolescents, and she also has done a lot of her own research in ADHD, Attention Deficit Hyperactivity Disorder, and we're really happy to have you here, Megan, just to learn a little bit from you and put our heads together about this important topic. We have a lot of parents that are pulling their hair out, trying to deal with some of the symptoms, which we'll be talking about today. So we're really excited to have you here and appreciate you and your expertise here. In terms of ADHD, is that a topic that you find some interest in yourself? And why is that?
I would say yes, mostly because of the experience that I have with it, personal experience, and the struggles that I went through as a child, and watching the way that it kind of affected the marriage and the whole family and my older sister. And those types of things. So it's always been really interesting for me to learn more about it and to help other people that struggle with having ADHD or have a sibling with ADHD or a parent that has a child with ADHD.
Or parents, yeah.
Or parents that have ADHD.
Because they're the ones that are losing their hair.
Yes.
Yeah.
And the kid.
Yeah. Exactly. It's hard. It's tough sometimes. And yet there's something about the spirit, I think, of an ADHD kiddo. And I hate to call kids an ADHD kiddo. I think more of in terms of they're a kid with ADHD. But, you know, it can be pretty enlivening of the family and the days of the family. And there's nothing like the joy that a kid has at Christmas, who has ADHD. I don't know. What's your thoughts? I mean, there are good and some hardships there.
Yes, I would absolutely say that ADHD isn't all bad. There is a lot of good things that came with it. It helped me a lot in being a college athlete. I was the one that would go work out 3 times a day, and a lot of the other girls were just like, relax. I actually had a coach that told me if you work out the same day as a game, you're not going to be able to play in the game. So that always helped a lot. But I would say a lot of the struggle in the family was just me always needing to be busy, changing out my binder every night, needing things to be different. It was hard for me to keep the same type of stuff, but I also thrived off consistency. So it was a little confusing with my parents on what needed to be the same, what needed to be different. And even like clothing and wearing outfits, it was hard to change those types of things. So I would say it kind of is across the board a struggle, but there's also a lot of positives to it, I would say.
Yeah. And I can only imagine that there's a lot of parents that really gain from being able to talk to you and to get some of your advice on how they can manage their family system. And then I read this one time that if you've got a kid with ADHD, it takes a lot of forgiveness in that family. It just takes a lot of forgiveness and moving on and not falling apart because they are falling apart.
Yes, yes.
It's easy, you know, when someone is falling apart, and if it's your kid and they're falling apart, we get pulled into that.
Yes.
Very, very quickly and
Be
easily.
frustrating
Yeah.
for parents.
And then all of us males have ADHD. So moms have the hardest time. What do you think, Dr. Zach? Do you think that's true?
I see it in my own family. Absolutely. Absolutely. Well, maybe we can take a step back a minute and talk a little bit about what ADHD is. I know we get folks coming in to the center that parents bring their kid in for ADD and get, perhaps a little concerned when we start talking about ADHD. Like, my kid's not hyper. That's not why I'm here.
Yes.
And so we have to do some education. I had to look this up because our DSM, our diagnostic manual for diagnosing various psychological and psychiatric disorders changed. In my brain, it feels like it was 10 years ago. Do you know how long ago it was when we changed?
What, 40?
40.
At least. Yeah.
40.
Right.
38 to be exact.
Yeah.
38 years ago, we stopped using the term ADD. The manual changed to ADHD. And so we have, some different categories. So maybe you can kind of talk a little bit about that.
Which is interesting because I feel like it's become more prevalent in the recent days. It wasn't even really noticed 40 years ago. I would say a lot of ADHD, the confusion is like impulse control, talking back, disrespect. I get a lot of kiddos that the parents come in and they're like, the teacher's just complaining that my child's disrespectful. They don't listen to me. They just lollygag out the door when we're in a hurry to get somewhere. And it's just not us understanding really time management and being in a hurry, thinking we can do X, Y, and Z within 10 minutes when it's really like an hour-long task. And so that can be something that's confusing to the parents because it looks like the child just doesn't care,
right,
or doesn't want to be there. But it's more about there's so many things going on in our mind at one time, and trying to compartmentalize what's important in that moment can be very difficult. Prioritizing a lot of activities I like to do with clients and parents is doing prioritizing. So we'll list out what is the things that we need to get done this week. And then what is the priorities that are this week? Like, yes, you need to probably vacuum the house, but getting your math homework done that's due tomorrow or having a big test is probably going to be something you should focus more on than the vacuuming the house. And it's funny because I'll do those things late at night. And a lot of times I'm like, there's other things you need to be doing right now. But I would say a lot of the struggle, even with the parents, is understanding that the child is impulsive, but it's not a choice. It's this thing that gets in our head where we're like, this has to be done right now.
Right.
And if it's not, it just becomes like an anxiety attack or an outburst, as most parents see it. And then lastly, I would probably mention emotional regulation. A lot of parents don't understand, or maybe they do understand, but they're just confused by it. They want to understand more about it. Would be the emotional regulation piece.
That's
so,
definitely
yes.
Yeah.
How did you go from being so calm to so overwhelmed within such a short period?
Yeah.
And Dr. Zach, I think, and you may have to help me remember this term, but before the 40 years ago,
Right.
it was called something like minimal brain dysfunction.
That's been a while. It was.
Yes.
It was.
Can you imagine that label was put on people?
Yeah.
And it was hard. And, typically, I think it's in the DSM where we have about 3 types, although
categories.
there's been some people that have identified about 7 types.
Wow.
And even more.
Right.
And I think that's true just because if you think about each person being a unique individual, they're all going to have a presentation that's quite
I think
different.
ADHD, like autism, I think there's a spectrum. I absolutely think there's a spectrum. And speaking of, I think helping parents understand those ADD kids, now we consider it ADHD, predominantly inattentive type.
Yes.
We have ADHD, predominantly hyperactive / impulsive.
Yeah.
And then we have ADHD combined, which is kind of both the inattention, the focus, and the hyperactive impulsive. And so it can look different ways.
Right.
And we have to manage.
Interestingly, too, some of those very impulsive kids can have some pretty good attention
Right.
in class.
Yes. No trouble at school.
But they're very impulsive, so they get in trouble.
Right.
Yeah. Or less
Blurting
trouble
out.
at school, lots of trouble at home. I get that a lot.
Yeah. And then there's the when you said a few minutes ago, my kid is not hyper. Yes, there are inattentive types
Absolutely.
that are not. And then, and when you think about spectrum, I've heard some theories that ADHD is on a spectrum, and the higher up you get on that spectrum, with the symptoms getting stronger, it melds into some ASD,
Right.
because there are symptoms of both in ASD and ADHD.
Yes.
That rigidity,
Yes.
inflexibility, unable to move can be in both. And that's when you get the tantruming and the
Yes.
yelling or the crying
Yes.
that you were talking
Or
about.
even like the stimming. I sometimes can see that in ADHD kids. That's a big thing that I notice as well. That kind of overlaps. And then like more of the detailed, I feel like that kind of overlaps as well, with detailed verbal instruction. And a lot of times in class, they say that ADHD hears 1 in 3 words. So a lot of times a teacher might give a lecture and the kid comes home and is like, fails the test. And the parents are like, you weren't listening in class. You must have been distracted. But the child was fully listening and taking notes and everything. And they just missed half of the lecture, which ended up being what the test was over.
Right. It can be really problematic.
And we're going to talk a little bit about what you can have helps in school. A lot of times now, particularly in public schools, but also private schools, at least here in Dallas, have what we call a 504 plan. Private schools don't call it a 504 plan, but we have a 504 plan in the public schools, and you can get some supports and helps to what they call even the playing field. But that brings me to something that I'm going to address to you first, Dr. Zach, and then I'd love to hear anything that you would like to say about that too. But how is ADHD diagnosed? You are involved in our testing program, and so you're on this quite a bit. What about diagnosing ADHD? What do we do in our clinic, per se?
Sure. Well, and I'll back up. You know, there are screens, so brief, abbreviated sort of questionnaires that parents can complete, that can give a general idea if we have ADHD happening. But I will say that to really get a better understanding of a child's mind, to really dive in and understand where there might be some deficits, where there are strengths, a full psychological evaluation is really needed. And that is something that we do at the clinic. And so, it involves lots of tests. It involves working with the kid and doing some testing. It involves getting some collateral information from parents or teachers to really take all of that data and get an understanding of, we're talking about it. There's so many differences. So we really want to understand their strengths and how we can support those strengths, and then also where there may be some slips, and so that we can.
And you
help.
can go to a physician. You can go to your child's pediatrician. They can look into it to some extent, but what I find is a lot of pediatricians like to see the full assessment done, where they can also look it over and make maybe perhaps a better determination about medication, perhaps?
I think so. Because again, a hyperactive type is going to look very different than an inattentive type. And we won't know that unless we're really looking at, some of that hard data.
Yeah. Anything that you would say in terms of your experience, do you try to get folks to maybe do an assessment if they're wondering about it in your work with kids and teenagers?
Yeah, I think a lot of times, like you said, going to the pediatrician is a great thing. And the pediatricians are wonderful for many things, but specifically for mental health, I think the psychiatrist, the psychologist, those types have a little more background on it. And so that was always beneficial for me as well, getting that information from them, getting that testing done from them. So a lot of times I try to relay that to parents. Like, I understand you had the pediatrician testing, and I know you're on this ADHD medicine, but maybe that medicine isn't best for the kid. And that can be a case where the psychiatrist can come in and adjust the medication and help with changing it.
Pediatrician.
Or pediatrician in both ways, yes. But the testing, I think, is a little more extensive, like you were saying, by getting all the knowledge of the brain.
And I think, the thing that really is helpful with testing is, you were talking about 504 plans. We often will provide lots of recommendations, particularly, certainly for the parents, but also for schools. And may recommend accommodations that can help the kids. So if we know that we have some memory issues, right, there may be some things that we want to recommend. If it's more inattention, if it's more hyperactivity. So I think that is really critical, so that we get the kid the kind of support that they need, especially at school.
Absolutely.
Absolutely. Yeah. What about executive functioning? What is executive functioning, Dr. Zach? What is that? Why do people throw that term around all the time?
My brain loves to talk about the brain.
Why do people throw that around a lot?
ADHD is considered an executive functioning disorder. What we're talking about is our prefrontal cortex. And I like to explain to parents that this part of our brain is kind of like the CEO. It's the head chief of decision making and all things important. And when we have some slips, right, and our CEO, it's not doing its job, then we're going to have some problems, right? We're going to have some difficulties.
You were really staring at me.
I thought you'd been. Is your CEO not working?
Absolutely. Not working.
Yeah. And so this is, when we're struggling with slips in executive functioning, this is where we have our difficulties with decision making, with planning, with organization, with impulse control, with emotional regulation. All of these things are part of the executive functioning that our brain is supposed to be helping with. And so I read some research recently that suggested kids diagnosed with ADHD, their brains are developing at 2 to 3 years behind their peers, which I think is really important for parents to understand, teachers too, everyone to understand.
Yes.
So, when a kid is tantruming at 7 and we wonder, why are they having these huge emotional outbursts? You were talking about kind of the going from nothing to...
Yes, quickly.
So if you think that 7-year-old is really functioning more emotionally at a 4 to 5-year-old level, then it makes sense. They catch up.
Yes.
They catch up. But
Takes a while.
Takes a while. Yeah. Other thoughts on that piece, regarding the brain and executive functioning?
Yeah, I think another one that we haven't really touched on would be that filter. Saying things, even, seeing other people's reactions, because sometimes we don't understand what we said was maybe kind of out there. And then someone else looks at you and you're like, maybe I shouldn't have said that. But I think a lot of times that we're able to pick up on body language pretty well because we do those things. So we're looking for a response in someone else to see if that was matter of fact or if that was out there. I would say another thing probably, as well as the filter, would be the impulse control. I think that's a huge one for all. I think that's kind of across the board for ADHD. And just being able to know, like, okay, I can't do this right now. I can't buy this right now. I can't say this right now. All of those things. But yeah, I would agree with you on all the emotional regulation piece and everything else you talked about, and how the brain is just behind, but it does catch up. And then we have superpowers, I like to call them. So I wouldn't I wouldn't necessarily say it's always a downfall or a negative thing. I think there's great things that come with it. And just us going out of the box and doing things we're not asked to do, or going overboard on a lot, putting in that extra effort, I think is just a superpower, truly.
So, I'd like to hear from both of you, but maybe I'd love to start with you, Megan, if we could, about what about differences developmentally? And I'm looking at, in terms of, and this is kind of broad, but the ADHD child, and we could say school-age child, and the ADHD teenager. What have you noticed about differences between the teenager and the child, and how it plays out uniquely with the teenager, and then, perhaps maybe why that's uniquely different from the child, if that
Yeah.
makes sense.
I would say a lot of times with my kids, there's things that they just absolutely can't control. So when you get to kind of the teenage years and you've been dealing with this for quite a few years, you're able to kind of understand, oh, there's my ADHD. I'm distracted, or you're able to get those accommodations that you kind of need because the homework gets harder. As far as the children, though, I think the parents need to be a lot more involved. So a lot of times, like, I would almost look at my parents for a reaction to see, like, is what I'm saying kind of out there, or am I good? And then as a teenager, you're on your own a lot. So like you're in class, you're doing hard things. You're not able to really focus on someone responding and telling you if it's acceptable or not. I think that's a huge difference, especially accommodation wise. I think that you really need those accommodations as a teenager.
Absolutely. One thing that I've noticed is about the activity level. It seems like when they're kids, they're running all the time.
Yes, that's true.
On their tiptoes and everything else. And then when they get to be teenagers, they can become a slug bug.
Yeah.
Yes.
I don't know how many parents have noticed that too, that
Yes.
I can't get them out of bed.
Yeah,
They kind of become a slug bug, but there's still some hyperactivity as well.
absolutely.
What have you noticed about
I
that?
was going to say the same thing. I think the thing that I see more in the teens, the behavioral things sort of slow down a little bit. Perhaps they are learning some organizational strategies, some different things, but the motivation, I think that tends to take a big hit where they just can't get motivated to do their homework or to study or to do chores around the house. There does tend to be, it seems like, a slip there where they struggle a little more.
Yes, I agree. I love that
Yes,
because
that's
I'm always talking with most of my parents of teens about how to build a fire under that motivation. It just seems to not be there.
Yeah.
And that's where parents are despairing.
Yes.
Which brings me to something that I think we've really got to discuss here today. And are there any parenting strategies in terms of helping? One of the things that I've loved hearing from both of you is, as a parent, slow down.
Yeah.
They may not be computing. They may not be getting it. I think it's very interesting what you brought up, Megan, about the fact that kids, they're sometimes realizing that they're missing the mark. They're not quite hitting it.
Right.
And then I noticed that you said sometimes you would look to your parents to see if you were on track or off.
Yes.
And I think that does build over time. But what about strategies from early years to later years? Anything that you would say that would be very helpful to parents?
I would say starting with patience and research. The best thing you can possibly do for your child is to better understand the issue.
Yes.
I like to compare it a lot of times to even like illnesses. Like if someone had some sort of a heart failure or anything like that, you wouldn't look at them and be like, why is your heart hurting today? What's going on? Why are you struggling today? You would look with them with empathy and you would understand today's just a hard day. And we have those as well in ADHD. Some days we just really need that extra patience. And some days it can be the days that you just don't have that extra patience. But finding that balance in each other, a lot of times I like to suggest to the parents creating a calm corner, having somewhere where the kid can go when they're having these problems so that you're not always having to be the person to soothe them. Because I know sometimes you don't have that space to be able to give that to the child, depending on what you have in your own life going on. And I would just say, in general, I think parents maybe talking to the child. So explaining this is why we're doing this rather than you're doing this and not giving them a choice. That's where you a lot of times see that fight back and wanting to be in control a lot of the times.
Yeah. I love what you said. I think that just needs to be in bold. Parents having patience,
Yes.
empathy, and understanding.
Yes.
Because it can be frustrating. I have an ADHD son myself. And to this day, it can be frustrating when I've told him 1,000 times to pick up his, can that he has left or his water bottle on the kitchen table or, wherever and over. It can be frustrating. And so having that understanding, it's not purposeful, it's not intentional. I think, parenting children anyway is hard.
Yes.
Yes.
It is hard.
I've often said anybody who has a child needs to be on an antidepressant. It's hard.
It's hard. You need a lot of tools in your toolbox.
Yes.
I truly believe parenting a child with ADHD almost requires a black belt in parenting. A lot of understanding,
Not to use on the kid.
not to use on the kid in their toolbox. Lots of tools, lots of need for education, just to understand, to learn some tools. You know, one thing that I always suggest to parents, I think it's across the board, whether it's hyperactivity or, you know, more of the inattention. We really know that the ADHD brain tends to respond better to visual cues
Absolutely.
than auditory.
Absolutely.
And parents, you know, kind of yelling across the room to the kid to do X, Y, and Z is often not effective.
Yes.
And so I know for our little ones, sometimes we might recommend, I mean, for the itty bitties, you know, even pictures, right, of tasks that need to get completed.
Love that.
Or, you know, for our little older ones, we might have a list, you know, on the fridge of things that they need to get taken care of, making eye contact when you're asking for, you know, them to do something. Are there other things that you recommend?
I really like the listing. I'll have the parents kind of print off pictures of morning routine, evening routine, and then laminate it so they can use expo markers each day, and then start over the next day. A lot of times positive reinforcement is huge for ADHD.
Praise.
Yeah, so instead of telling them what they're doing wrong, tell them what they're doing right, and, you know, show them like, wow, like today you picked up that can. That's awesome. Instead of just every time they forget the can, reminding them you forgot the can again.
Right.
You know, giving them that feedback that you're doing great or you turned your homework in. And then lastly, I would say calendars. I think calendars are huge because a lot of times the kids need that reassurance of what's happening tomorrow. So I have a test tomorrow or I have to be there early tomorrow. And so they wake up in the morning, they're like, oh my goodness, I forgot. Like you were mentioning in the beginning, a lot of just memory kind of problems. So that visual reminder can be huge for the child, for the teenager, even for the adult that might be struggling with this.
For sure.
And I like that.
I think, you know, especially for our younger kids, that time blindness can be a problem where they might be hyper-focused on something and just completely lose track of time. And so using timers and, you know, today technology, using Alexa, right? Or using, I mean, so many different ways that we can help kids sort of understand, you know, we have 10 minutes before we leave for school and putting a little timer on so that they know, okay, it's time.
And that right there is something that we did, and it really helps kids with ADHD is to give warnings and helping them to shift their brain to the fact that something different is coming.
Right.
And it will call on some different resources for the kiddo. We are going to be leaving in 5 minutes. You got 5 minutes to continue playing that game.
Right.
But then we're going to be moving and then giving another reminder and giving another reminder. We do that in our play therapy so that the child can get their brain changing. All kids need help with that, but our ADHD kids need it desperately. And we can't remember, I was a teacher, I'd call them in from recess.
Yeah.
Well, you know, it'd be nice if all of them lined up quietly and just came into the classroom and sat down. But the ADHD kid probably hasn't shifted the brain yet.
Yes.
And so helping them. I love what both of you said about being positive. Find what's right. If you stroke what they're doing right, you're sure to get more of that. If you're stroking the negative by calling out that, did you pick up the towel? Did you da-da-da-da-da? They're probably not going to be doing anything except that still, because we're stroking the negative. So you get what you stroke, but it's hard. I understand as a parent. All of us understand it just gets hard.
Yes. But even like you've mentioned before, about telling them, I need you to do this rather than do this.
Yes.
I think that's a huge thing as well.
I need, I want.
Yeah.
Instead of saying you need to pick up the towel, which gives the ADHD brain a reflex that is, I don't need to do that.
Yeah.
We give them, I need you to do that.
Yes.
I want you to do that. It comes out firm, clear, and it also kind of takes away the argument because it's something that you're wanting, you're needing.
Yes. Yeah. I think that's a great point.
Well, we are already out of time, and I feel like we could have done more. But for more information, please look on our website, www.drbekloff.com, drbekloff.com, and you'll find more resources there. We've appreciated Megan Rosewell so much. She is fabulous. She's one of our directors, and we're so glad to have her part of our team. Thank you, and we'll look for you the next time.